and welcome. Today, it really is my pleasure to introduce two very special people from the New England area, Sri Rajesh Vaidishwaran and Srimati Deepa Subramaniam. Welcome to Lokvani.
Namaste.
These two amazing people are the core team members and actually the founders of the Sankara Healthcare Foundation. This organization has been working tirelessly under the leadership and the inspiration of the Kanchi Kamakoti Peetam and the Shankaracharya of that Peetam to bring about an impactful change in the health and well-being of people both in the US and in India. Today, they are going to specially talk to us about Project Heal, where they are working to bring plant based food to the US to not only improve the health of people generally, but also to support those underprivileged people who are in need of food, whether that's in the homeless shelters or other at this particular time, particularly with the frontline workers and others in the US. The Rajesh is an engineer by training and a really focused volunteer and a devotee of Jagadguru Shankaracharya. And it is with the inspiration and in fact the instruction of the great Jagadguru that he has started this work. Deepa here is a very special individual who is also, of course, very actively involved in this project. But in addition, she runs shloka classes for some special needs children. I have listened to some of those children beautifully articulate the shlokas, and she's just done a terrific job. So really wonderful to have you both here. So let me begin by asking you, Rajesh, to tell us a little bit about the Shankara Healthcare Foundation. I know I talked about it briefly, but if you could go into depth about the different projects, I would love to hear more about that.
Sure, Ranjaniji. So we were started in 2010 as Shankara Cancer Foundation because Jagadguru Jayendra Saraswati Swamiji asked us to help with women's health and women's cancer in Tamil Nadu. And specifically, we were focused on Trichy through the Hindu Mission Hospital there. But in 2015, Jagadguru Shankara Vijayendra Saraswati Swamiji blessed the organization with a new name. He said, call it Shankara Healthcare Foundation. And he expanded our scope to serve many more of the Shankara and Hindu Mission hospitals. And he, just with that expansion of scope, came expansion into other areas like prosthetics, cardiac care, eye care, dialysis, diabetes, and nutrition. Swamiji also said, since we all live in the US and we work in the US and we are in the US community, that we should also focus on helping people in the US community, not just in India. So one of the things we had to do was try to find out in this fairly complicated healthcare scene in the US, where we can make the most impact. So that is Project Heal. I'll talk about it slightly down the road, but the flagship project that we have been actively fundraising for in India to implement in India is called Wellness on Wheels, or WOW. And this is really a mobile health unit that will be equipped with a digital mammogram, and it will have facilities for cervical screening, and essentially it can serve as a fully private women's healthcare center, so that when we take it into villages, there is no need for trying to curtain up schools and things like that to give women the privacy they need. And the bus is also going to have other educational materials on things like diabetes care and nutrition, so that people get as much out of one of the visits of this bus to their villages as they possibly can.
That's fantastic. Really, really. You know what this brings to the forefront is that I think even traditionally, the ashramas and the pitams were the instruments to make impactful change and to bring about support for the community. So, what I think about is sometimes people think of these pitams as just religious institutions, but they are really working tirelessly to make a difference. And I can see that there were a lot of things that were happening earlier, and that Swamiji asked you to expand that to bring these kind of services, especially for women. And I can quite, vibe with that. That I think what you are doing could really relieve the preventable problems like that of cervical cancer and others. So really, really kudos to you. And I think at this point where we have technology that enables us to do these mobile units, and which are, I think the prices are coming down significantly. So I think we hope people reach out to you and really help fund this kind of thing. So really kudos to you about that. And so now I think I would really like to go to Project Heal. And could you tell us, is it just a New England initiative? Is it an American initiative? I would love to know more about it. Why is it called HEAL? I would love to learn more about that from you.
Sure. Um, Project HEAL stands for Healthy Eating and Living. So it's really an acronym. And it also, since our focus is plant-based food in Project HEAL, we think of plants as having healing properties. So we want uh, people to connect plant-based and health and healing. Um, it is really a pan-US project. We have multiple centers where we currently have coordinators for HEAL. So there are. It was started in Boston, the New England area, and we expanded it to Seattle last year. Um, and Ms. Archana Sunil, wonderful volunteer. She is really amazing, and she's put together a very nice community out there. We expanded to Missouri, St. Louis, and to California this year.
Wow.
And we have Srividya Ramesh. She is also a wonderful volunteer, and she is put together during COVID times, getting people to come and help uh, ex- basically start a project Heal there was her initiative entirely. In California, we have Vijay Shankar. He's the director on the board of Sankara, very dynamic guy, and he's working with a really beautiful organization in the West Coast to bring Heal to the masses there.
Wow.
So
And Heal, what does it do? I hear there is plant, I hear there is food. And
yes,
so tell us more.
we wanted to do was just to do fresh, home cooked style food where the nutritional aspect was important, and we wanted it to be plant based. I would, I can elaborate on why plant based. If that is important as a question to
Oh,
answer.
I mean, I think we can certainly lead people to go into our, the written interview so they can get some of the more details about
Sure,
why plant-based diet. But you
sure,
certainly believe for sure that it's very important for health. And I think also, I
that
think
is
a little bit of the idea is that while dairy and all that is okay, it's also the treatment of the animals, of how they are treated. I think that becomes very focused. And I'm hearing, am I right? And maybe Deepa, you can tell me this, that the foods that are plant based are actually better for you, right? When it comes to inflammation and all of these things. Is that right? I think I mentioned,
Definitely. Yeah, definitely. And I think they don't harm, first of all, right?
yeah.
So they do have a lot of nutrition. And as people probably know, a lot of the protein, the source is actually original sources from plants.
Hmm.
And they do have and whether they heal or not is one thing, but they definitely don't harm. And the more we actually establish a plant-based healthy diet,
Right.
you're definitely your entire metabolism is really chain to work in a specific way, and I think it does a very good job
So
of
what I
bringing
understand it
overall
here is,
health.
what I understand here is then that basically what you're saying is let us bring the right diet to those people who are already suffering from hunger. So hopefully their health improves, and then not only they are getting food, but they are getting a healthy meal, and hopefully they understand the value of it too, and then maybe their health
Yes,
improves and they jump out of the cycle of homelessness through better health is what I'm
yes.
understanding. And Deepa, so tell me more. You said Rajesh was mentioning that cooking. Do you actually cook? And is the Rajesh the cook, or are you the cook? And how is the food given?
Mostly so we are actually, what this heal has really helped us find out is just new options, right? So as you know, our Indian food is, if you just take out the ghee part of it and some of there are so many options, right? There are just so many options. And we actually make vegan more korma at home, if you know.
Wow.
So
Coming over for dinner.
vegan avial, yeah, vegan avial and vegan more karma. I mean,
Yes.
there's just there's a lot of options here. So I think a lot of people are buying into this. Initially, there was some, how do I make pasta or make lasagna without cheese and everything? But there are vegan alternatives. And, when we actually talk to the people, the frontliners, all the meals that we've been serving have been vegan, right? So we've, I think, overall served at least 4,000 to 5,000 meals just since COVID.
And you're cooking yourself in serving?
No. The frontliners has all been restaurant based.
Okay.
The cooking, so we're forming, I'll just talk about how we are doing it in the Boston area, is right now we're working with 3 big shelters in the Worcester and Fitchburg areas. So we formed about 12 groups of really, passionate, volunteers. So there are 3 shelters, 12 groups. So we are trying to see every group does it once a month. So, we have rotation. So they are getting food once a week. So we have every Saturday, one group is, cooking, a healthy 1 big tray of vegan food. Options are Indian food, pasta, anything, wraps, falafel wraps, so burritos. So there's a variety that we've actually been trying to bring in for these shelters. So
that's amazing. That's really great. And then now you are coming into the COVID era where the food delivery really changed quite a bit. So it went from homeless to other things. Could you tell us about that?
sure. So obviously, a lot of the frontliners are not taking home cooked food, right? And we've been working with restaurants. As you know, restaurants have also been hurting at this point. So we've actually tried to work with the restaurants close to the different rehab centers and hospitals. For example, we've been doing Boston here. In the Boston area, we've been doing rehab centers in Boston, Brookline, West Roxbury, and then as far as even Rhode Island and some of these other places. So we've been working with local restaurants over there and to actually cook vegan food. And then we have contacts at all these places. So we've been delivering them. And I know in some of the other locations also, they've been doing the same, working with restaurants or caterers to provide vegan cooked meals.
So do you see the future after all that you've been doing with the restaurants and everything, that the world will change and we'll get more tasty plant-based foods everywhere? Are you seeing that as a trend?
There is a lot more acceptance I can definitely see. It's not going to change overnight. I'm sure people need to see that vegan food is tasty as well as it's nutritious. Yeah. I mean, there are people, the feedback I'm getting, a lot of people don't even know it's vegan, right? Because the feedback that I get is it's just delicious food. Sure. So as long as it, it serves your palate and then it's healthy, I think there will be acceptance.
That's great. So Rajesh, would you be able to tell us what has been the impact? You've brought all this, wonderful plant-based food for some time to the homeless shelters. So I'd love to know both the impact for that and also your work with the frontline workers at COVID and what that impact has been.
Sure. So when we started HEAL, we started in 2018 with really only one shelter which was even interested in serving plant-based meal. They were like, the rest of them were like, no, we need, this meat or that meat, or So we said, okay, let's just go with this one shelter. And we had been working with them for a couple of years, and we served over 2,500 meals a year there in each of them. Small incremental steps. So it's 5,000 meals we had served by end of 2019. And along comes COVID, and within the first month and a half, we had served another 5,000 meals. Of so we crossed 10,000 meals just somewhere mm, in the April timeframe, April-May timeframe of COVID, and we had also added Seattle in 2019, and we had added St. Louis and Bay Area in
Right.
2020. So the point that Deepa made it was exactly the point we were seeing was once people started eating, they even the frontliners, right? When we started getting requests from nursing staff, it was a little puzzling initially because I thought, hey, the nursing staff are all employed by hospitals, and they probably get pretty good food in the hospitals. So why are they asking us for help? And this opened a somewhat uncomfortable door to what the healthcare system here looks like, and just up close and personal. That some of these staff who were serving in these hospitals, they are also two-income families, with one of them being a nurse and the spouse being in retail or somewhere. And when the retail side of it shut down,
Wow.
they went from being you know a middle class family pretty quickly overnight to needing social assistance.
Wow. So you're saying by bringing this into the nursing staff, not only are you bringing better food to them, but actually, really, they are also a little bit struggling at this time while doing frontline work. They are struggling for, basic
Yeah,
well, and
I
that's
mean, at least some part of them that is
well.
friendly.
And
Yeah.
so Project Heal really filled that gap beautifully to make that happen. Over 10,000 meals, that's a lot. And God bless you for doing that. And so it's been, all of that has been pretty much from the restaurants at this point. Is that right?
No, not all of it has been from the restaurants. Some there are at least a couple of shelters that we are working with. What they do is they are very resourceful in that they try to get as much of community raised agriculture
Yeah.
uh, uh, as possible, and they have a lot of volunteers who cook in house.
Ah,
So the cost of bringing that kind of food, exactly what we
sure.
want to be brought to the people, is drastically reduced. So we, instead of writing checks to restaurants, taking donations and writing checks to restaurants, we work with them to carve a specific meal, and we underwrite that effort entirely, because that is also another effective way to bring this. Uh, just short of us cooking, that would be the most effective way. Um,
That is amazing. That's truly amazing that you're accomplishing so much with so little. And I think that's every dollar seems to go very, very far with what you're doing. So tell us a little bit about how the community can get involved in what you're doing. How can they help?
sure. So as of now, uh, we have four coordinators for Heal, as I mentioned. In Seattle, there is Archana. In St. Louis, there is Srividya. In California, there is Vijay. And in the Boston area, there is Deepa. And if anyone wants to get involved, they can just reach out to us at heal@giftofhealth.us. That's an email address they can go to. And it'll reach all of them. And if there's any interest in starting and helping in a new region, it's the same place. You can just go there and say, hey, this seems to be very interesting. We would like to start. If people are interested in just donating to the work, they can just go to our website, www.giftofhealth.us. And we have many projects. Heal is one of them. And we would love your involvement. We would love people to get involved both in the work we are doing in India and in the work we are doing in the US.
It's really fantastic. I just quickly wanted to ask you, I know that you have had the opportunity of talking to Jagadguru Shankaracharya. It seems like so amazing that you were actually able to be in his presence. So can you tell us a little bit about what that is like, and how that blessing comes to you, if you are willing to share? It's always a question of curiosity for me.
Sure. So uh, the Acharya is uh, extremely approachable. That is the first thing you find when you step into Kanchi Kamakoti Peetam, is that there is really no filter between you and the Acharya. There are not no people trying to figure out what you have and what. You just go there, and he would want to know who you are, what you're doing, and uh, he asks very specific and very pertinent questions. Um, Initially, I used to wonder how he gets down to the bottom line so quickly. Then it became very clear. He His first principles of thinking are always aligned with dharma. So how do you do lokakshemam? How do you do welfare for the world? Is really the only way he approaches uh, every topic. So with that, the first thing he would ask is, so when I went to see the current Peethadipati, Jagadguru Shankara Vijayendra Saraswati Swamiji, we call him Balapariva. Now we call him Pariva. Uh, he asked, so you're in the US, you're doing this. How are you helping people in the US? And I'm going, oh, it's very complicated to help in the US. He said it may be complicated, but I think it is your duty to figure out a way to help. And that that sets you on a path of thinking. And what is more amazing is when you start thinking and reaching out to people, a solution shows up, and which you would never have considered because you never thought along those lines.
Wow. Just amazing. I someday maybe we all can have that opportunity to meet him. I know we saw him on video the other day, but it's quite a blessing. I think both of you are certainly blessed that you must have done something great in your previous life, that you have had such a strong connection with the Peethadipati, and you are doing so much good in this life. So thank you for what you're doing. Thank you for supporting the community, and thank you for thinking so innovatively. When Balapariva told that to you, you were able to find something very creative to do, and to do welfare for the world. And so, really, really an honor and a pleasure to talk to you. Thank you so much for giving your time. And maybe some other time we can talk about plant-based diet and why it's so important. So maybe we'll have another interview and we will present that to the world at large as well. Thank you
Thank
so
you.
Thank you.
Thank
Thank
you,
you.
Ranjini. Namaste.